So today on the 24th of March we held a participation forum for patients, carers, users of services plus the third sector to talk to them about the review and explain the process that we will be using going forward to take their views on board, listen to what they have to say and devise the options for consideration at consultation during the summer. What was really helpful was the participants were able to look at certain pathways of care and try to work out, as we do as commissioners, what they would prioritise and how they would prioritise the resources that we have for those particular pathways. So they got the opportunity to say, were I the person that was responsible for these services, I would put more emphasis here or there. And we've collected all that information in the round as part of the overall consultation process to help guide us and see where the priorities lie for the public. The Milton Keynes Healthcare Review is so important to the future of Milton Keynes because we're growing as a city, the population is expanding, our services are getting stretched, we have a limited amount of money to spend and we have a real opportunity to look at how we deliver those services so that we can plan for the next 10 years to deliver what's required for the population. Once we've actually received back the views from the consultation, it is quite a time before you can actually implement the outcomes of the consultation. It takes time to listen to what the population has said, revise and revisit those plans, and then agree across the system what it is that we can and wish to deliver going forward. So realistically, I think you're looking at a 5 to 10 year time frame to deliver the outputs of the healthcare review. It's really important that we have joined up health and social care for Milton Keynes. From the patient or the citizen's perspective, they want to see a single person visiting them in their home to make sure that they're well looked after and they can deliver that care for them. We can do that. We certainly can work in a more joined up way so that they find our services simple and easy to use and to receive. We're all very used now to accessing our bank services out of hours, and I think it's the norm for the public now to understand in our busy lives that we can access care out of hours or out of normal working hours in much the same way we use other important services in our lives. It's particularly important for health and social care because if we can reach people's needs very quickly, we often can delay or minimise their use of more acute services. So if someone is not well of an evening, if we can get the service to see and assess that patient very quickly, they don't necessarily then need to make a visit to the hospital, which is much, much better for the person involved and makes better use of our services overall. Care close to home is a very important strand of the future of healthcare services and the way that we would like to deliver those services for the population. We want to ensure that our services are in the right place at the right time, and we are looking at offering care close to home in order to support speedier delivery of care for patients. It is really important to get the views of users, patients and carers for those who use our services in Milton Keynes, because we need to develop services that will work for them, that will be robust and last for the future so that we can plan services for the next 5 to 10 years. The review is happening at this fast pace because there is a real requirement to make sure that we can live within the resources that's available to us. Healthcare budgets have been protected, but we're a growing population. More people are needing to use our services year on year, and we have effectively a finite resource to commission that from. Clinicians are at the heart of the decision-making process for the Milton Keynes Healthcare Review. They're leading the discussions with the public, with their clinical colleagues, helping to shape what the services ought to look like for the future, looking at the best practice that we know from national and international models of care and helping to distill them and decide what would be right for Milton Keynes. And so the stages in the process of the healthcare review for Milton Keynes are that until the beginning of the summer, we're working to develop the options to go out to discuss with the public, so consult on those. That will likely be over the summer months, and then from the beginning of next year and onwards, we will be implementing the outputs. During the consultation period, we'll be listening to the views of all the people that have been involved, both the public, clinicians, listening to what they think about the options that will be put forward for them to consider.